Drug Talk. Today we're going to be talking about a medication known as Lamotrigine. So Lamotrigine is an interesting medication because it's actually commonly used in two different scenarios. One is when people have epilepsy, that is they're suffering from seizures, as well as when people have mood disorders. So it can be used as a mood stabilizer. The brand name of Lamotrigine is Lamictal. There are a couple different formulations to talk about with this brand name, Lamictal. One is just the normal tablets that you would swallow whole. These come in 25 milligrams, 100 milligram, 150 milligram, and 200 milligram tablets. Lamictal CD represents the chewable tablets. These are available in 2 milligram, 5 milligram, as well as 25 milligram. Lamictal ODT, which is the oral disintegrating tablet, comes in the same strengths as the first one that we mentioned that you just swallow whole. Finally, Lamictal XR comes in a 25, a 50, a 100 milligram, 200 milligram, as well as 300 milligram. So we mentioned that Lamotrigine, or Lamictal, is oftentimes used in mood disorders, so in bipolar depression. It's commonly used and works very well in rapid cycling bipolar. So that's when people go from manic to depressed very frequently. It's also good to prevent people from having those episodes, so the manic or the depressed episodes. In terms of its use as an anticonvulsant, it can be used by itself or as an adjunct therapy, oftentimes paired up with a medication known as valproic acid. Some other things it can be used for are paroxysmal pain syndromes, migraine headaches, panic disorders, post-traumatic stress disorder or PTSD, and finally paranoid ideation or hallucinations and some negative symptoms associated with schizophrenia. When it's used as a mood stabilizer, the dosing usually begins at 25 milligrams. Then, the physician would increase the medication as he or she sees fit by about 25 to 50 milligrams a week, reaching a maximum dose of 400 milligrams a day. When it's used on its own for mood stabilization, we usually see doses anywhere from 50 to 150 milligrams taken twice a day. When it's paired up with valproic acid, typically it would start at 25 milligrams just at bedtime, one single dose, and it would be slowly increased or titrated to 100 milligrams at bedtime. The maximum dose when it's used as an adjunct therapy is 200 milligrams a day. The dosing is a little bit different when it's used in epilepsy, with a starting dose of 12.5 to 50 milligrams taken twice a day, and increasing by 50 milligrams every 1 to 2 weeks. There are some precautions that your clinician would use before prescribing this medication. Early on in therapy, when you're being treated for mood changes, it's important to have regular follow-up so your physician can make sure that there's no emergence or worsening of depression or suicidal behavior. It's also important that you're explained about the risk of developing a rash with this medication. See, with most medications, if you were to be allergic to the medication, that would usually present as difficulty breathing or hives. With Lamotrigine, the rash, if you experience one, could be a little more serious. Actually, it could be a lot more serious with this medication. The precaution that your clinician would take would be to start at a low dose and increase your dose slowly to reduce the risk of developing this rash. This serious and sometimes fatal rash usually occurs within the first 8 weeks of starting therapy, but it can happen beyond the 8-week mark. Patients would be instructed and educated to immediately report any signs of rash to their physician. Also, there are some systemic symptoms like fever, pharyngitis, or other flu-like symptoms that you should watch out for. If you experience sores or blisters on the soles of your feet, or on your palms or mucous membranes, as an example, your mouth, you should also report this to your physician immediately. Your clinician would use caution if you had renal impairment, as the half-life, or the time it takes for the medication to decrease its concentration by a half, would be increased. Side effects that are common but not life-threatening are dizziness, nausea, or vomiting. Just keep in mind with the nausea and vomiting that if it becomes flu-like and very severe, that you should want to report that to your physician. Headache, as well as abdominal pain. If you were to overdose on this medication, there are some separate side effects that would happen just in these cases, such as ataxia, or loss of complete control of body movements, nystagmus, which means involuntary eye movements, delirium, seizures, and sometimes even coma. Some medications have antidotes in the case of an overdose. Lamotrigine or Lamictal does not have an antidote. Therefore, your symptoms would be treated. In terms of monitoring of the medication, Your physician would always monitor, as well as your pharmacist, for side effects. Some medications that are used to treat mood stabilization, as well as epilepsy, have blood levels that you can get checked to make sure that the medication is at the right concentration for the right effect. With lamotrigine, there's no blood work that's required. Lamotrigine can be used in adolescents as an add-on therapy in refractory bipolar depression. The side effects they experience, that is, children, are headache, tremor, somnolence or sleepiness, as well as some dizziness. Occasionally as well, some kids can develop tics. That's all we're going to talk about today with Lamotrigine or Lamictal. As always, this page is only to be used as a source for information and not to make any personal healthcare decisions. You're always to check with your personal healthcare provider before you make any decisions regarding your medications. If you'd like to help see the channel grow, you can like the videos or subscribe to the YouTube channel. Or you can even hit that share button. Alright, thanks for stopping by. Take care.